Good evening, Stuttgart community. My name is Colonel Jason Condrey. I'm your Garrison commander. I'm here tonight with Lieutenant Colonel Troy Baker, our Public Health Emergency Officer, and we're going to do our best to answer many of the questions that you, the community, have sent our way. We'll start with some initial comments. I'll initially hand over to Dr. Baker, and then I will do my best to provide some answers to the many questions you presented. And then I'm asking that the questions that you have, we'll have the team here pitch, and we'll do our best to give those answers on the fly. The intent is to keep this to about 30 minutes, and we'll start from there. So,
sure. Okay. So again, I'm Lieutenant Colonel Baker, the Public Health Emergency Officer here, and just a few little update on where we're at. So at this point, we have about 2,000, a little over 2,000 cases in Germany. So it's doubled really twice in the past week. So it was around 500 last Thursday, Friday. It's now 2,000. So it's going about 25% per day on average. And so that's where we're at. It's continued to be at that rate. We're about 10 days behind Italy in terms of where they're at. So wherever you see Italy, we're trying to track it along those same lines. So just keep that on your planning processes. The best thing we can do right now is social distancing. Social distancing will help flatten out the curve. Any outbreak follows a curve. It rises and then it falls. Our goal is to have it be as flat as possible. That will allow emergency services to work better. That will allow everything just to be a lot smoother. If it hits all at once, it'll make things a lot tougher to react to. The symptoms you should be looking out for: fever, cough, body aches, kind of the whole influenza, flu type illness type things are the things you should be watching out for. And especially if you have a strong link to a high-risk area, then we want to know about it. So really the question is, who to call, where do you go when you feel like you have these things? Best thing to do is somehow leave a message with the clinic. There's a few different ways to do that. If you have access to Relay Health, we would prefer that you go through Relay Health. It'll leave a message right to your team. We'll get in contact with you and see if you meet the criteria and then bring you in. The other thing you can do is the call center, or you can do the nurse advice line. That can also get us letters as well, or messages as well.
do you want to talk about whether or not someone should come to the clinic, or what the process is once you establish contact with them?
Sure. So the question is, who do we test? We test people that have a strong link and also are having symptoms. So if you have a strong link, would either be a close contact to someone who has known coronavirus, or if you've recently traveled to a country such as Italy, Korea, Iran, China, things like that. So if you have symptoms and a strong link, we want to test you, and that's when you come in. If you just have a link, i.e. if you have a close contact with someone, or if you're just in those areas but you don't have symptoms, you don't need to come in for coronavirus testing. You just need to quarantine yourself. And the question is, what's quarantine? Quarantine is something we do for asymptomatic people, so people who are not having any symptoms but have been exposed to it in some way or another. People can be exposed through close contacts or through travel to those countries.
And what does it look like? Where here on the installation should people come to once you've called and said, let's do testing?
Correct. So people are going to come to the clinic for testing, but don't just come to the clinic without calling us first or leaving some sort of message. You can if it's an emergency, or if you just haven't figured out a way to do it. We do have people at the front who will direct you, but ideally the best way to do it is to call us. And we have a mobile clinic, or a mobile testing station that we put in the parking lot of the clinic, and we will test people out there. You won't get the test back for between 3 and 5 days, because we got to send it up to Landstuhl, and then they'll do the test there. But what will happen is we'll meet you, and then we'll talk with you and determine if you do have a strong link, and then we'll determine if you do have the symptoms. If you have the link, to an exposure and the symptoms, then we're going to go ahead with testing. And we'll test you for things like flu and maybe strep first. And if you're positive for flu, the risk for co-infection right now is still pretty low, so we'll consider it flu and send you back. But if that's negative and you still have a really good strong link, we'll then do the coronavirus testing for you at that point. And that's done in the in the red box by the clinic, and you'll see it.
Okay, great. I'll tell you what, I'll jump in here.
Yeah.
Try and answer some of the other questions that have come in. So you've heard the term health protection condition. And as of today, we moved to Bravo. And so the definition of that is defined as an outbreak or heightened exposure risk. Actions include strict hygiene, no handshaking, wipe common use items and surfaces, and avoid contaminated areas. And then if exposed, self-isolate. We've also added some measures from Health Protection Condition Charlie, specifically the social distancing. So understanding that is a relatively new term, new to the Army, other than some that have read a very niche Department of Defense instruction. Those are the things that we're going to start posting signage for, so you understand what the status is. There is the potential that we could move to Charlie, and the distinction between what we're doing now and Charlie is basically where we halt all movement and shelter in place. I want to talk about the Garrison responsibility. So we're focused in two primary areas. The first one is the protection and the prevention of the spread of the virus. The second one is the continuity of operations, maintaining critical services so that this community remains ready. That's the civilians, the service members, and all of the family members. So with respect to protection and prevention, starting tonight at midnight, you will see a change in access procedures to the installation. You will no longer hand your CAT card to a PONS guard. You will hold it up so that your barcode can be scanned, turn it over so that the guard can compare pictures. If there are multiple people in the car, the driver will do that. So effective tonight, that will happen. If you happen to drop your card, the PONS guard will pick it up and give it back to you. The PONS guard will be wearing gloves. Isolation and quarantine facilities have been established on the installation. So we have identified one location where if we have people that arrive and do not have a home where they can self-quarantine or they can be isolated, then we've established a place with furniture, with appliances. We've got linens, just put TVs. We have the ability to flip on internet. We have enough to make it so that if a 14-day quarantine or isolation period is necessary, it will be as bearable as possible. Doc already talked about the separate COVID-19 testing area. We want to make sure that we don't lose the ability to see all patients at the clinic. And the first time that we get somebody that is COVID positive inside the clinic, then we have to do some significant procedures. So there's people there to catch you before you come in if you are experiencing symptoms, but be sure to look for that red container that's in the parking lot as you're looking at the clinic to the right. We've established a contact trace team, so that if we have a positive case, there is somebody deliberately focused on who did that person interact with, what places did they go. We very quickly want to understand how quickly we need to ask people to self-quarantine. Closely linked to that, we've asked units to stand up cleaning teams. So if that individual was in a workspace, then that cleaning team then has to go back through and clean that area so that it doesn't pose a threat to anybody else in the workspace. You've already seen the cancellation of services, community events, sporting events, all of that, all of those things that require some social distancing or you can't do if you're implementing social distancing, we've turned off. Our schools have already developed distance learning vision or venues and are prepared to implement lessons plans should we have to close schools. Currently, I understand that the Minister of Education for the state of Baden-Württemberg has a press conference scheduled for tomorrow. We will look to see what happens outside in the local community as a result of that press conference. And the last thing, and this is an example, I want to make sure that we are consistently maintaining communication with the community. I want you to understand that what we're doing, why we're doing it, and I want to be able to be align those communication efforts with mission partners so that the same communication is happening at echelon. Continuity of operations. So there are some things that we must continue to do. Emergency Operations Center has been established here in the headquarters for protection, fire, emergency services, guards, our MP patrols. We must maintain some capacity in each of those. Public Works public works and utilities. We have to keep the lights on, have to keep the water running. We're focused on maintaining a minimum capability there. Feeding, so the commissary, the food courts, all of those things that, because everybody is on separate rations and needs to go to a grocery store in order to feed themselves, feed their families, we're focused on keeping those areas open. Acknowledge that 78% of our community lives outside. My understanding, the stores will remain open. Those will be a critical focus for the community to ensure that people still have access to food. Childcare. So we're talking about schools or CDCs or school age centers, all of those things that we have in place that deal with our kids. I am confident that both the schools and the CDCs have implemented rigorous hygiene and hand washing protocols. Throughout all the schools, multiple times a day, our kids are washing their hands. At the CDCs, as soon as they arrive, and with almost every transition, whether it's outside in, after a meal, moving from one space to another, they're washing hands. If you bring your child in, ask your child to go wash their hands. Don't depend on that direct supervisor of children to do that. And then hotels. There's another capability we have to keep running 24/7, especially with a change in our ability to move people in and out of the country. So Doc talked about social distancing, the 1 meter rule. I need everyone to implement the 1 meter rule. You'll notice that we are 1 meter apart. So it applies everywhere. It's the driving reason behind the cancellation of events, the bazaar, adult and youth sports, a lot of our fitness classes, all of those things that you depend on day in and day out. I'm going to get to some of the specifics here. I'm asking you to avoid unnecessary travel. You change work practices. If you can find a way to work from home, work with your supervisor to see if that's possible. Unnecessary contact with others. Again, the 1 meter rule. Should be no shaking of hands, hugging, and for all the high schoolers out there, as we remove chairs from the bowling alley and the food court, do not sit in each other's laps because there aren't enough seats. Parents, I'm asking your help with that. I don't want to get to the point where we have to close down those services at lunchtime or after school. So how may services be impacted? I'm going to talk about some of the shortfalls. In some cases, we get specifically trained staff that do only one thing and have access to a system. If for some reason they have to stay at home, that service is no longer available to the community. We're studying what services will have the greatest impact and see if we can create some redundancies. Supplies. There is a shortage on cleaning supplies. If you stood in the line outside the commissary today, you probably noticed that. That's also true for our janitorial contract who gets supplies from a distributor in town. The moment I am not able to keep a facility clean to standard, I will close that service. Food courts and defects. I want you to do takeout only. That minimizes your exposure to others. Also, solves the sitting in laps problem. Religious service, will shut those down. The Garrison chaplain is looking for a way to deliver via the same method I'm talking to you tonight. Adult and youth sports fitness classes canceled. We've canceled events. The Kelly Theater was supposed to open production this weekend. I'm sorry, that's canceled. Classes at Arts and Crafts, the library, MWR tours, Host Nation orientation, hospital tours, Skies group classes. Some individual classes may be able to continue. Community events at the Galaxy Bowling Center or the Patch Community Club or the Schwabian, all of those have been canceled for the month of March. We will start looking at those events we currently have scheduled in April. Conditions will drive cancellations. So, responsibilities. I've talked about what the Garrison is doing. Units, I need you to streamline some of the reporting. We've got the Operations Center set up. We've finalized reporting. We want to make sure we understand who in the community is self-isolating, self-quarantining, has restricted movement, who may be arriving. Those are some critical pieces. I'm asking units to help establish support concepts for those individuals that have to isolate or quarantine. Our commissary doesn't have the ability to deliver groceries by by drone. So somebody's going to have to make that linkage. And I need units to be prepared to execute troop diversions. So individuals, talked about this. You are our first and best and most important line of defense in this. Wash your hands. No hugging, no handshaking. Keep 1 meter separation. If you feel ill, stay at home, call a doctor, get some advice. Strict hygiene. I am comfortable with owning the clean hands process for our schools and our CDCs. Do not expect the Garrison to provide clean hands for you as you go in and out of all the services. I simply don't have the hand washing stations. I don't have somebody that can supervise you doing that as you go in and out. You will see some other installations doing that, but I don't have an infantry battalion to put against that requirement. We will seek to put the few hand washing stations that we have at some of the critical services, like the commissaries as an example. I'm going to depend upon you to clean your hands as you come in and go out. Buy in moderation. I understand today that the street value of a roll of toilet paper went up tenfold. I understand there's a lot of things that people are trying to prepare for. We have limited supplies in our commissaries, but supply lines have not been disrupted, and they're not expected to be disrupted. So as things come in, they will be restocked on shelves. I've asked both ACPs and our commissary managers to take a look at those things that disappeared off the shelves quickly and implement buy limits. So please bear with us. I know that'll be a source of frustration, but I want to make sure that for those things that are important to you, we get at least some in the hands of everybody. Okay, the other thing, and I know this has been a big question, is the stop move directive. So as of last night, there was a presidential announcement, which was very quickly followed up by a Secretary of Defense directive. So effective Friday, the 13th of March, there's a 60-day stop movement if you were traveling to, from, or through a CDC Category 3 area, which is almost all European countries. All PCS, TDY, government-funded leave, personal leave, and non-official travel falls into that category if you work for the U.S. government. Retirements, and those of you that are getting out of service, you're exempted. You will be able to return back to the United States. If you're not in that category of retirements, there are exceptions. Commanders will determine what's mission essential. We're responsible for identifying humanitarian and extreme hardship, and then the proper authority will determine the adjudication for those case-by-case instances. Another question about family members. I picked up my parents at the airport yesterday. They're here. The question is, will they be able to go home? Short answer is yes. We've just posted the details in a whitehouse.gov link on our Facebook page. You can go there to get these details. But the reality is, if they are a family member or a U.S. citizen, they will be allowed to return back to the United States. They will have additional criteria upon return, most likely some sort of self-quarantine or isolation, maybe some medical screening of some sort. It will depend, and that will evolve. So at this point, we'll take some questions. I know there's a lot flowing in.
So, sir, for Colonel Baker, there's a couple medical questions that came in, and the first one is, have there been any COVID cases on post?
So the short answer to that is no. There have been no COVID positive cases. We've done some testing, and they've come back negative thus far. But for the most part, what has happened is they've come in and they're what's known as a patient under investigation, a PUI. And to meet that criteria, you have to have the exposure as well as the symptoms. But those who have shown up have most of them have either been influenza, so they pop positive for flu, and so at that point, we're done. And they go home and they isolate themselves because they have the flu, not because they have the coronavirus. And yeah.
Okay. The next question, it's a bit of a curveball. Does the DoD concur with Germany's estimate of 70% infection rate amongst the German population?
I'm not sure what the DoD has said. 60 to 70%, I think, is what the Germans are saying. I don't know if it will get that high, but I think it will get high. The question is how quickly it will get high. And our goal is to flatten that curve out. A lot of people are saying, oh, it's the coronavirus. Everyone's going to get the coronavirus. Who cares? Maybe, maybe not. But if we can flatten that curve out and prolong it, it'll slow things down. It'll keep everything from kind of crashing. So that's the reason we're doing things like social distancing. The social distancing has been shown to be one of the few things that actually help improve and slow the epidemic down.
Another question that came in, where do civilians, DoD civilians, go to get tested? Should they go to Patch or elsewhere?
Yeah, so 2 places DoD civilians can get tested. DoD civilians, they're our community. We will take care of them for testing at Patch Clinic. We just need to know about you, and ideally, you call in. We have the nurse advice line, but you know what? If you just can't get in, and you think you have symptoms, and you think you have an exposure, just come in, and we have someone at the front who will make sure that you don't come in the clinic, and then we'll tell you where to go, and which will most likely be go sit in your parked car by the red box, and we'll then bring you into the red box and test you there, and send you on your way after that. And really, we don't really treat so much in the red mobile station. It's more of a testing station, and then at that time you go home and self-quarantine yourself pending the results of that. You could also go to the German hospitals. There are 3 hospitals that I know of in this area that are doing testing, and they'll do the same criteria. They'll ask you if you have the good exposure, they'll make sure you have the right symptoms, and then if you meet those criteria, they'll test you. If you don't, they'll say you don't meet criteria and send you back.
But in that scenario, you will get the test results and you need to communicate those to your organization or chain of command, correct?
Correct. So if you just go to the German hospital, we're not going to know the results of that. We're not even going to know that you went. So it's important that you let your supervisor know, because the supervisors, they're reporting up their chains, and then they send the reports to me on a daily basis, and then we'll be able to get the reports. So then we'll know, and we'll be able to track folks.
So the next few questions are about travel. We're receiving a lot of questions about travel. One is, can the Garrison control spouses travel? And also, does the travel ban of 60 days apply to German local nationals?
So the Garrison can control people that are under the employ of the U.S. government. I can make requests to family members not to travel. I think that if it becomes problematic, you will find that other countries close their borders. So I know there's lots of questions. We have spring break coming up. We have travel plans. I think you need to make some serious adjustments to those plans as quickly as the world changed for us here in Germany as we were watching things happen in Italy. I anticipate that the next evolution of this will be will have similar restrictions to what our friends in Italy are experiencing now. And so I know there are financial implications to that. I know every scenario is going to be slightly different, but with this in mind, you need to think about how quickly this could happen. And be prepared for it.
So the next few questions have to do with people who are PCSing or are already in the process of it. What if we are PCSing, we've lost our lease? How long can we stay in a hotel? Who'd be paying? And along those same lines, people who are PCSing, will TLA be extended to those who are set to PCS?
Right. So I know the simplest thing is to say effective this date, you will stop movement. But the reality is a PCS is not a distinct one-time event. There's shipment of household goods. You've already given up, your apartment. You're living in a hotel. Your vehicle is gone. There's lots of. Every situation is going to be different, and so working currently right now to get authorizations to extend entitlements for TLA and things like that, to ensure that we're not going to have any member of our community that is put out or under undue financial hardship as a result of this. And so again, we talk about those. There's some unique situations out there, some that you can't even imagine that we'll have to deal with. But when we talk about humanitarian reasons or extreme hardship, that's exactly the criteria that some of our members will find themselves in. And the critical piece will be communicating that up through your organization to the level that the decision will be made.
And sir, finally on travel, and again, we're getting a lot of similar questions, but I'm in the USA. Can I return to Germany on Monday? And will DoD civilians on TDY be allowed to return home to their homes in Germany?
So to my knowledge, there hasn't been a halt on travel back into into Europe, into a CDC level 3 area. I think the limitation will be whether or not an airline will come here. So they may bring a plane load of people here, but if they don't have any people to return and they don't have the ability to get that air crew back, or that air crew then has a 14-day quarantine when it returns to the United States, that is probably going to be the greatest limitation to getting travel here. So if there's somebody that needs to return, I think the sooner the better when it comes to international travel.
Sir, the next question has to do with DoDEA schools. Again, quite a few questions similar in nature about DoDEA. What's the Garrison's communication with DoDEA? And if DoDEA is now canceling events, should children be in schools or CYS?
So, 24 hours ago, we were leading relatively normal lives. 24 hours from now, we may be canceling schools and closing CDCs. There's an impact to our ability to continue to do the mission, the reason why we're here, when that happens. And so that's part of the consideration. The driving consideration, though, will be ensuring that we don't spread this virus. And so that will determine when we cancel schools.
Sir, the next couple of questions, and again, very similar in nature, have to do with logistics. Will there be rationing at things like the commissary and the PX? Will we be implementing ration controls?
So we have implemented some buy limits. It's mostly on things like Clorox wipes, thermometers, face masks, hand sanitizer. We'll add toilet paper to the list along with paper towels. So there are some things that I think as of today we will implement some buy limits. I'm asking for some feedback from ACPs and the commissaries. And as soon as we know what those buy limits are, we'll publish them on Facebook so that when you're standing at the shelf, you're not frustrated at the Garrison for not letting you know that you could only buy 10 rolls of toilet paper.
And again, in the vein of logistics, sir, is there any plan in case Stuttgart closes public transportation?
So I know that the organizations across the installation are trying to figure out how they will be able to continue to do their mission and at what point they can degrade down to, especially as things like public transportation close and there are some, the potential for strict guidance, movement only to and from work. You can only go to a grocery store. Those are the kind of things that Italy is now dealing with. The reality is, I am not going to be able to come get you off the installation to bring you to work. So as you talk about these continuity of operations within your organization, discuss, if you are mission critical, how you can get to work, especially if you don't have your own transportation.
And back on the medical side, Colonel Baker, there was a question about what German hospitals locally are conducting testing.
Yeah, so it's, I don't have the names on my head. It's, I think Robert Bosch and Marion Hospital.
Klinikum Stuttgart.
And the Clinic Stuttgart. So there are 3 of them. We'll put those up on the Facebook page for you as well.
And then probably our final question, sir, as we're coming up to about the half-hour limit, is can you review the status of FMWR facilities? And there have been some concerns about the cancellation of some of the trips and refunds for people.
So canceled events right now. Kelly Theater is canceled. Classes at the Arts and Crafts and Library, and to include in that if you have a birthday party scheduled, those are canceled. MWR tours. Host Nation orientation and hospital tours, SKYS group classes. Individual classes may continue on a case-by-case basis. All the conditions for those are unique, and so we'll have to talk one-on-one for those. Community events at the Galaxy Bowling Center, the Patch Community Club, and the Schwabian through the month of March have been canceled. So with respect to refunds, I don't know exactly how we will do that. We're working to find that solution, and as we get that information, we'll be sure to let the community know.
And one final question, sir, before we start to close. Will the post office continue to operate for normal business?
So right now, the intent is to keep the post office open, but that's one of those capabilities that if I lose postal workers, I will have to keep it, I won't be able to keep it open. And so as you're standing in line, I ask that you do that 1 meter check and ensure that you are implementing social distancing. Any more questions?
There's a lot more, sir. I think we're going to have to get to a few of those in a frequently asked questions.
Okay. So, first of all, I appreciate the participation in this venue. We will continue to try and answer as many of your questions as possible. You know, I understand that in less than 24 hours, our world has changed dramatically, and I can't tell you what our new normal is going to look like. I don't have all the answers, and probably have just begun to scratch the surface on the questions that I need to be able to answer. So I'll continue to share what I know. We'll continue to try and keep you as updated as possible and provide the information that you need when you need it. I'm asking that if you need my help, let me know. Find a way to get the word to us, and I will work to resolve that. We'll keep this video up. It'll be recorded. I'll keep looking at the questions that you have after the video, and I appreciate your time this evening. I know this is a pressing topic for the entire community, and we'll continue to do this as often as is required. Thanks. Have a good night. Thanks, Dr. Baker.
Yeah,